CDC and SHE guidelines to reduce catheter-associated urinary tract infections strongly recommend properly securing the indwelling catheter to reduce urethral traction, tissue damage, and patient discomfort. Medline's Securement device offers proper securement to not only reduce these issues, but to promote proper urine drainage. Using Medline's Securement device is as easy as place, prep, attach, and secure. The catheter securement device should be placed on the patient's high thigh or abdomen to prevent the catheter from causing unnecessary damage to the skin, bladder neck, or urethra. To apply, straighten the patient's leg, then pull gently on the catheter so it lays completely straight along the thigh. Once the catheter is straight, move approximately 1 to 1.5 inches up the leg towards the catheter tip. This is the area of the patient's leg that should be prepped for application of the device. For best results, the securement device should be applied to clean, dry skin. Prep the patient's skin by first cleansing the area with an alcohol pad to cleanse and degrease the skin. After letting the skin dry for 10 seconds, apply Medline Shore Prep to the site. This skin prep will help form a protective barrier on the skin and minimize damage during removal. After using the Shore Prep, let the skin dry for approximately 1 minute or until the area is no longer tacky. To minimize irritation when the device is removed, hair on the skin may be trimmed prior to placement. Lift the straps from the device and place the drain tube access port next to the foam barrier with the port access facing up. Attach the straps around either side of the access port, securing the catheter in place on the device. This method for securement can be utilized regardless of the type of catheter. Alternatively, you may secure the device around the Y junction of the catheter. Simply pull back both straps and place the catheter along the foam strip so that the catheter Y junction is centered. Secure the top strap over the catheter and the bottom strap over the catheter just below the Y junction, anchoring the catheter in place. Remove the first piece of backing from the securement device and position the device on the high thigh of the patient with approximately 1 inch of slack on the catheter. Then remove the second backing piece and secure the other side of the device. Gently press on the adhesive to ensure the device has been completely secured to the patient's leg. Finally, wipe a final coat of Shore Prep around the edges to firmly adhere the device. Please note that special care must be taken with the bariatric patient. The securement device should be placed in such a way as to prevent the catheter and drain tube from falling into the skin folds, causing erosion of skin, or getting placed under the patient, contributing to ulcer formation. Inspect the skin regularly and avoid positioning the individual directly onto medical devices, such as tubes or drainage systems. This supports the rationale to minimize the risk of device-related pressure ulcers. Medline's securement device is designed to improve patient comfort and minimize tissue damage by using a gentle adhesive. Due to the nature of the adhesive, the securement device should be replaced every 2 to 3 days. To remove the securement device, an alcohol prep pad may be used to loosen the adhesive. Gently ease one corner of the device off the patient's skin. Continue removing the device by using the alcohol prep pad to loosen the adhesive between the skin and device. If reapplication is necessary, it is suggested to place the device in a different location than originally secured. Securing the catheter is an important measure to reduce patient discomfort and injury, as well as encourage proper drainage. Medline's securement device allows you to achieve these goals, offering a secure anchor that is gentle on patients' skin.